So this is the general overview for the consultation that will cover you for most cases that you get in the exam. So grips, focus history, examinations, explain your findings from the history and the examination, explain any provisional diagnosis, any further investigations that might lead to the diagnosis or to give you more information if you already have the diagnosis, and management. So we're using this structure, GRIPS. So that stands for G for greet, R for rapport, I for introducing yourself, P for purpose, S for smile. So, I mean, a lot of this is kind of intuitive, so you don't need to use a memory aid to remember this. This is just kind of for anyone that wants something there for, you know, to fall back on if they feel anxious in the exam and they feel like it gives some comfort having something there that they can just remember and just do when they're feeling a bit, you know, overwhelmed, which can happen in exams. So yeah, main thing is, you know, when you greet the patient, make sure you wait for a response, see what they say, because there might be some useful information. If you just kind of say hello and then go into your whole shtick of what you plan to say, and then you've got all the way to the end of smile, all the way to the end of the purpose, and the patient is like really distressed about something, it's not going to look good to the examiner, because it shows that you're not really aware of your surroundings. So you need to wait for a response, see how they respond. They might give you a cue at that point, and you'll need to react straight away. Try not to be too rigid in the system or the structure that you have. And we will talk about, so we've got structure here, but it's important to emphasize that this is just training wheels to help you, you know, if you want a starting point. But I'm sure most people, you know, they've been taking histories and examinations. That's a skill that is ingrained for a long time. But if for whatever reason they haven't, this is a good way to start. But you should definitely, with time and with practicing more and more cases, become more and more flexible. Just so yeah, definitely make sure that you respond to any cues there and then as they happen. Don't leave them till afterwards and tell the patient, no, I'm not going to, you know, because it's not in your structure yet. You have to address them. They're addressing it for a reason. Sorry, they're bringing it up for a reason. The other thing is make sure you use your full name. I think most cases that I've seen have been talking about situations where you're either in a department in the hospital or the GP surgery. I've not seen, they seem to be like acute cases, the ones that are in the department, and the GP surgery tends to be the more chronic cases. But or, you know, someone presenting with a non-urgent problem. I haven't seen many outpatient clinics in hospital scenarios, but I think that's mainly the main two. So this is an important part of the slide, is if you do like to have a structure, I find this particularly useful myself, is splitting it into, is this a first presentation or is it a follow-up or an admitted patient? If it's the first presentation, then you just, you know, when you were at medical school, you're doing your finals and stuff, use the same kind of structure, you know, ask them, the presenting complaint, what's brought them in today, how can I help you today, whatever goes with your kind of style, presentation style. But with follow-up or admitted patients, it might be useful to use this structure, which is a 3 Ps. So the first P is position, the second P is prior understanding, and the third P is plan or paraphrase task. So position, you know, what is this? Is it a follow-up? So I understand that you're in follow-up, so you need to clarify that. I know it says it in the prompt, but it's worth clarifying that with the patient, making sure you're on the same page. Then check their understanding. This is really important throughout the consultation. This is the first part, the first time that you're going to be checking their understanding, but you'll also be checking their understanding when you're explaining any potential, any provisional diagnosis, or even a diagnosis that's already been made previously and they've had a condition for years. You'd still need to check their understanding about their condition. That's really important. And then also checking their understanding when it comes to management as well. So this is a really important thing. Examiners really love it when you make an assessment of their understanding and then give them a tailored response according to what they've said. You don't want to be in that situation where you gauge that level too low or too high, and you, for example, you assume that they're too you assume that their level is much lower than what it is. that can come across as patronizing. Or similarly, if you assume that their level is much lower, is much higher, and then they feel kind of intimidated, and you don't. The examiner will pick up on that. Like the patient will feel intimidated, and that he needs to start using clever words and stuff. I think it's really important to be down to earth, not to try and be too clever, not to come across as clever. You've demonstrated in the first exam that you have. You know all of the medical terminology. You know how to think. You know how to approach cases. So you've already demonstrated that. This is more about how you come across as an individual. Do you come across as likable? Are you aware of your surroundings? Are you reacting to what you're seeing? Are you just following a structure, or are you flexible? Are you able to express yourself in a way that's kind of logical and in a way that resonates with the patient? So I think that's the purpose of this exam. So I think that's really important. So check the prior understanding. So a good general question would be, can you tell me a bit about what's happened so far? And then it can give you a little run through of their entire journey. And that can give you a nice overview of what's been going on, so you can kind of tailor the way you approach the consultation. And then finally, plan or paraphrase the task. This is just kind of repeating what was written to you in the task. So yeah, that's you can never go wrong by just doing that. So I think just clarifying with them that if it's okay that you do that, and then obviously smiling, that's actually really important. And I think because we're in such a stressful situation in exam day, we often forget that. We're all focused about remembering everything, and the academic aspect and the decision making and what's the diagnosis, and we're all focused on that and how we're coming across, but we forget just to come across as friendly and smile. I think that will really make a big difference. And again, this is the more that this consultation comes across as a conversation, the better. Don't think that, oh, he's lacking, you as long as it's mostly a conversation, but you kind of cover in all the things you need to, then that's fine. You don't need to list off everything. You will definitely gain a lot of marks for being very natural. So Dr. Arun, is there anything for the greeting and the introduction to the consultation?
In terms of the greeting, so I generally introduce myself as saying, "Hi, I'm Dr. Anna, GP. How would you like me to call you?" So that way it makes it very friendly and approachable, and then the patient will say, "Oh, I'm call me Jack or Mr. Smith," and then you confirm the details. So date of birth and address, and then go on to say, "Hi, how can I help you today?" So that way it gives a bit more of a conversational nature to the history taking, rather than again being very structured. And puts the patient at ease. And as you said, Dr. Hashim, give the patient some time at the start so that they feel they are able to express whatever they want as well, rather than being too structured right at the start. Yeah.